Hi, welcome to another edition of MD Insight. My name is Conor Delaney and I chair our Digestive Disease and Surgery Institute. And I'm here today with Dr. David Liska. David is one of our colorectal surgeons, and we're going to talk through some of the interesting things he's been doing in his career. But maybe, David, you'd talk a little bit about what you do and maybe how you became a colorectal surgeon. What drew you to this field?
Sure. So, as you said, I'm a colorectal surgeon. What drew me to colorectal, there were many things. But one of the things that I really like about colorectal surgery is the great variety we get to see, both in our patients. We see many different ages of patients. We see young patients, we see older patients. We see different disease processes, benign, cancer. And our procedures are also quite varied. We have some very sort of old and true procedures that we do that haven't changed much over the last 50 years. And we have very new and high-tech procedures that are evolving as we speak. So it's this great variety that was one of the things that drew me to colorectal surgery. Another thing that I really like about colorectal surgery and that really drew me to the field and that drew me to come here to the Cleveland Clinic and work here was that in colorectal surgery, the quality of the surgery that we do, especially in rectal cancer surgery, really makes a difference in terms of patients' outcomes, in terms of the cancer, but also quality of life. And really the difference between somebody who's experienced and has expertise in rectal cancer surgery, that makes a huge difference. And being able to provide that to my patients, that was something that was very important to me that drew me to the field.
Yeah, well, I'm a convert, obviously, and I would agree. I think the variety of what we do and the anatomical precision and the difference that makes is absolutely key. So one of the really important things you've become more involved in over the last few years is the concept of enhanced recovery after surgery, which we started many years ago as fast-track surgery, obviously. But also you've been able to build these pathways and build on what had been done previously and put it in place across an organization. Maybe you can tell us a little bit about your thoughts about enhanced recovery, and then also I think importantly for people about how you introduce it and how you make it effective and make it stick.
Right. So enhanced recovery, like you said, it had different names before. It's been around for a long time. And what it is, it's a care path that really guides the treatment of patients throughout the operative care, starting from preoperative to intraoperative and postoperative, with evidence-based measures that have been proven to both make the recovery safer and faster. And the goal of enhanced recovery after surgery is really to get the patients back to their baseline state sooner after the stress of surgery. And there's many different measures that can be part of an enhanced recovery pathway. And I think what really helps in terms of standardizing it and making sure that it gets included is by having it really be the standard approach for all patients. And there are some providers now that everybody realizes that enhanced recovery is the best way to treat patients, but there's still some surgeons who think that certain patients are not candidates for enhanced recovery. And what I think is really important is to realize that enhanced recovery really works for almost any patient or any patient. And even if you can't do every single item within the entire pathway, if you can do most or even just a part of it, it still benefits the patient. And we have shown this together recently in two papers that really show that enhanced recovery works for inflammatory bowel disease patients, which are more complicated subset of patients, and even patients who come to the hospital emergently. And even those patients which traditionally some people might think are not candidates for enhanced recovery, and we've shown that they do benefit from this. And I think if you have the approach that every patient is a candidate for enhanced recovery and just do it routinely for every patient with built-in order sets within the electronic medical record, that really makes it standard and then all patients benefit from it.
Yeah, I completely agree. I think this key of having it for everybody is important. So obviously there's pre and intra and post-operative components, and we won't dive into that for the interest of time. But tell me briefly your thoughts about prehabilitation, something we're talking about more and more.
Right. So prehabilitation is something that more recently has come to the forefront as another area where we can really impact patients' recovery, where we focus on the patient's preoperative optimization more than we used to before. And what I like to tell my patients is that surgery is like a marathon. And when you put that into context, everybody knows that you don't just go into a marathon without training for it. And And the same thing is true for surgery. You want to go into surgery being in the best shape that you can be. And there's many different measures that can go into getting to that state where you're in your best possible physiologic state. And there are different trials that have showed different ways. And it reminds me of the Rocky IV movie. I don't know if you remember it, where they juxtapose Sylvester Stallone and Dolph Lundgren, how they train. And Rocky is in that barn and running through the snow, whereas his Russian counterpart is training in this very elaborate facility with treadmills and EKG monitors and all that. And both training methods are valid and similar for rehabilitation. There can be very high-tech rehabilitation with monitored exercise, and that's great. And in some patients that are high risk, that's really what's needed. But really, every patient can benefit from even the most basic training, and that includes walking more before surgery, just getting some exercise, even the most basic exercise, focusing on nutrition, quitting smoking if you're a smoker. And those are sort of a few basic elements, exercising your lungs. And those are a few very easy exercises that any patient can do before surgery.
Right. I think it's critical. So in the last couple of minutes, maybe tell us a little bit about you. So you're one of a small number of surgeons who manages to have a clinical practice, and you do a lot of complex IBD and cancer. But you've got a lab. So how do you manage to balance that, and what are your thoughts about, translational medicine and the importance of balancing these skills?
Right. So I think as a clinician and as a surgeon especially, there's very few of us who have the opportunity to really take questions that come up when we treat patients on a daily basis and take that to the lab and try to find answers to those questions. And my interest is in rectal cancer, and standard of treatment for advanced rectal cancers is treating them with chemo and radiation. And at this point, there's really no molecular personalization that we do for neoadjuvant chemoradiotherapy. And also, the effects of chemoradiation are quite varied, where we have a percentage of patients, maybe about 25 or a third of patients, where the tumor completely disappears, whereas other patients have no response at all. And we don't really have a good understanding why some people respond and why others don't. And furthermore, if we understand that better, we can maybe even add an additional treatment that would then get more patients to respond, and maybe they can either avoid surgery, or even if they can't avoid surgery, have a much better outcome where the chance of the rectal cancer coming back is much lower. So as a surgeon, that's a question that I have of every single patient that I take care of, and then taking it to the lab and looking at mechanisms of resistance to neoadjuvant chemoradiation and coming up with novel treatments that could improve the efficacy of these treatments. That's something that I'm really interested in.
Yeah, it's a great interest to have, and it's important for driving things forward. Well, David, I just want to thank you for your time. It's been great talking a little bit about you and what you've done and getting your insights on these things. Thank you again for joining us on another episode of MD Insight, and I look forward to seeing you next time.
Thank you so much for having me.